Hello there and happy Friday lunchtime discussion today, all about functional seizures and treatment. And I'm really welcome your input, your comments, your questions. So if you've got questions while we're going live to talk about treatment, put them in the comments below. If we haven't met, my name is Julie Hirschberg. I'm a neurologic physical therapist. I'm based in the Los Angeles area where I get to be a part of Re+active Therapy and Wellness. I'm the founder and owner, actually here in our West LA clinic today in one of our treatment rooms, and pretty obsessed with functional neurologic disorders and understanding them and sharing what is known. There's still a lot that's unknown, but sharing what is known about assessment and treatment, particularly for physical therapists and occupational therapists, speech therapists, psychologists. We run an integrated program for people with functional neurologic disorders, and we see a lot of people with functional seizures. So earlier this week, I talked about some of the neuroscience behind understanding seizures and warning signs. Yesterday, I shared a little reel with like these four steps for managing seizures. This is kind of the process that we use at Re+active. And today I really want to answer some of your questions. I brought your questions over here. So things like outcomes and prognosis with PT intervention. And I'm going to tell you, there's not a large randomized controlled trial in PT intervention in functional seizures. So I'm going to give you some clinical experience, and then I'm going to give you some of the research in other areas that as physical therapists we can apply. We're going to talk about the autonomic and sensory components of treatment because this is, I asked y'all and you said, let's talk about autonomic and sensory. One of the outcomes that is really common in the research and that we'll talk about clinically is preventing them. We can decrease the incidence of functional seizures and make them less frequent. So that was another question somebody asked me. Other people asked about symptoms that might occur after the seizure. So memory loss or other functional neurologic symptoms that can definitely occur after a seizure, and that becomes part of the treatment as well. Let's see, bottom-up regulations. We're going to talk about this as well because this is in the literature, and autonomic. I think I got all of your questions. So again, if you have questions on treatment, pop them here in the comments or send me a question and we'll hit on it today. So I shared in a post a few articles that I want to talk about today, and I'm going to include links to these articles in our newsletter. So our newsletter goes out every Friday to clinicians. You can sign up at reactiveeducation.com, and it goes out every Monday to patients or care partners or people who might have these disorders, and you can sign up at reactivept.com. So I will put videos, so this whole video series in there, and I'll put the articles. So let's dive into what is known about treatment in terms of the research. Much of the research in functional seizures actually comes from the psychology world. Functional seizures were called psychogenic non-epileptic seizures and they still are called that. And so you can imagine with that name, most of the treatment would come from the psychology world. And functional seizures are more common in pediatrics, so a lot of the literature is in pediatrics as well. I had the great opportunity to go to the Functional Neurologic Disorder Society meeting last year, and it was fabulous. And I got to hear a talk by one of the lead authors on a paper that had excellent outcomes for functional seizures. And this was called the Re+act trial. Let me pull up the name of the study. It's Retraining and Control Therapy for Pediatric Psychogenic Non-Epileptic Seizures. Erin Fobian is the first author, and she spoke at the conference really, really awesome. She shared the results of the study. It has been published and is one of the studies that has literally had the best outcome when it comes to functional seizures. What I love about this is there are this was implemented by psychologists, but there are components of this that I think are really important as physical therapists, occupational therapists, speech therapists that we could bring into treatment. So this Re+active trial, the outcomes that they found with this is that 57% of the patients who improved with their seizures, they have remained seizure-free at 1 year. That is excellent. And we do see that overall in the literature that most people with intervention reduce the number of their seizures, and it stays that way. So they have a good carryover with it. Also in this study, all of the children who underwent this treatment, they were able to get back to their activities. So including school. I think this is a big one. It's a big fear that a lot of kiddos that we see and their families is like, is my kid going to be able to get back to school and sports and their activities that they love? And in this study, they did. So the study, again, was published in 2021, and I'll put the article in our newsletter again. And when I think one of the pieces that was so helpful to look at in this study is really in the name of it. It's regaining control. And this is a huge part of what we do in physical therapy, in occupational therapy, in speech therapy, in psychology as well. So this is where I think this would be really helpful treatment principle to bring in if you are working with somebody that has a functional seizure. Now, one of the things I will say, so if you're a physical therapist, hear me out here. In the past, it was thought that physical therapists really did not have a role in functional seizures. And I actually don't think that's the case. However, I do think a physical therapist shouldn't be working as the sole person with somebody with functional seizures. So because we understand functional seizures as occurring due to a neural network dysregulation, I think we absolutely need occupational therapy, psychology on our team. And this is because I find those two components of our integrated team are so helpful in understanding nervous system regulation. So while I think a lot of these principles apply to physical therapists, I don't think we should do it alone. I think we need more. And, and I'm just like saying that for myself, even though I feel like, gosh, I know a lot about nervous system regulation. I know a lot about energy management and the sensory system and autonomic nervous system. I might even know more than your average PT. I still would not do this alone. I would not. I need a team. And so regaining control. So how can you, as a physical therapist or OT, psychologist, speech therapist, help somebody regain control? And that's a big part of the Re+active trial. And they actually really implemented this step by step by helping a person have other options for nervous system regulation aside from the seizure. So when we think about replacing the seizure with something else to bring nervous system regulation, what we think of, and this goes to somebody else's questions, are some of the bottom-up pieces. So I want to share a couple of other studies here that I pulled up. A lot of these are referenced in that book that I shared earlier this week. And I'll put this in the newsletter again. This is the Treatment of Functional Seizures in Children and Adolescents, a mind-body manual for health professionals. some of the research in their support, so it's been done in psychotherapy, but it's body-centered. So this is where I get excited because I'm body-centered as a physical therapist, many occupational therapists as well. So this is that bottom-up approach where they worked on components of the sensory system, including interoception, really important, to promote a neurophysiologic regulation and improve symptoms. So what they did, and they studied, and this is Kozlowska and colleagues. This was in Clinical Child Psychology and Psychiatry from 2018. Again, I'll put a link in for us. They did a 2-week mind-body program, and this included biofeedback and physical therapy, and 75% of their patients, they had 60 people in this program, regained function, and they returned to school with only very brief relapses associated with functional seizures. So a really great outcome in using this bottom-up, body-centered approach, which is really a sensory and autonomic approach. You've heard me talk about the pie chart. So when we think about functional seizures, we think a large component of sensory and autonomic. These would be ways that we would incorporate that. So what does that mean? What would we actually do? So for example, here, what we might be doing in physical therapy or in occupational therapy, and even bringing some of these into psychology, would be focusing on those components of the autonomic nervous system that might directly be contributing to a person's seizure. So we measure heart rate variability and we monitor it. And then as we go through a therapeutic task, we're actually looking at the heart rate variability response. We use the LIEF, it's LIEF. It's at getleaf.com. I'm not associated with this company, but we use the LIEF. It's a portable EKG. We monitor, it actually is like sticks on to measure somebody's heart rate and heart rate variability, and it gives us feedback. It also is a form of biofeedback for the person. If the heart rate variability lowers, the LIEF actually leads the person through an autonomic toning breath activity. And there's several different ways that they might do that. So I love using heart rate variability as a way to look at the autonomic component and to train it. So then I might do tasks. I'll grab something from here. I got a couple of things because I'm in the clinic. We might use bubbles. So we've got these literally all over the clinic. And this would be one way that we might do an autonomic practice, because it's a breathing practice, but it's not a just breathe. It's an externally focused breath. And so we might actually do this during an activity. So, I just got you all covered in bubbles there. But can you see how long of an exhale I might take for blowing bubbles? And this is not just for kids, by the way. Everybody can blow bubbles. What's really fun too is blowing and catching, and so you get some movement along with that. There's a lot of eye movement associated with it as well, which is great. So this might be one component of an autonomic practice. Now, do we just blow bubbles? No. I want to actually look at heart rate variability as we're blowing the bubbles. I want to see, does this task of a long exhale actually improve somebody's heart rate variability? And for some people, it does not. So then in that case, I might go to the sensory system. And I really have loved these little cubes, but you could do this in many ways. We use a lot of things that you can use tactile feedback. Dominoes are one, but these little cubes have been great. They're a fidget cube. Each side has a different number that you can pop in and then pop out. But we can have people use their sensory system to identify how many dots on this side. Okay, I have 6. Okay, let's like toss it up again, catch it. How many on this side? Okay, there's 1. So that's just a really simple way that we may tune in to sensory feedback from the nervous system and even train the sensory system. A lot of times in functional neurologic disorders, we actually see that the person may not have a good ability to do this type of activity, and therefore they may not have an accurate sensory map of their body. So the sensory feedback coming from their body to their brain is inaccurate, and it may actually be not integrated well. And we see this a lot. And if that sensory information is not integrated, you could imagine that leads to an overflow of the nervous system, which can contribute to a seizure. So it's not that we do these things in the midst of a seizure. These are pieces that bring nervous system regulation for a person. So through the sensory system, through the autonomic nervous system, and that regulation actually lowers the incidence of the seizure. It also helps with all of the other functional neurologic disorder symptoms. So these are just 2 examples of how we might bring that bottom up regulation to the nervous system. When I say bottom up, it's from the body versus top down from the mind. Those pieces can also be really helpful. The thoughts that go through our minds, understanding our emotional experience, very, very helpful. What we find best is kind of a combination of both of those things. And that is what, again, small amount of literature so far, but those are what have been found to be helpful in functional seizures. And again, I say small amount of literature. There is actually quite a bit of literature in functional seizures in the psychology world. These are the small amounts that we're bringing in the physical aspect to that as well, the physical and occupational therapy aspect. Another thing I just wanted to mention, because I was talking so much about heart rate variability, is, and again, I'll put this link in as well, there was a research study in epilepsy and behavior, this was in 2016, that looked at changes in heart rate variability associated with functional seizures. So the article was called Autonomic Nervous System Functioning Associated with Psychogenic Non-Epileptic Seizures, Analysis of Heart Rate Variability. And what they found here is that the most functional seizures were actually preceded by increased sympathetic functioning. And so this can be a way, I know some people ask, like, how could we prevent these? Well, one way is to train the autonomic nervous system to tune in to that sympathetic functioning and help regulate it. It's not that we need to get into sympathetic functioning, right? It's not that we avoid that or fear it at all costs. It's really that we learn ways to be in it safely. So that was that study. And actually, just last month, a study came out in Seizure, the European Journal of Epilepsy. This one called Heart Rate and Autonomic Biomarkers to Distinguish Convulsive Epileptic seizures versus functional or dissociative seizures. And what they were looking at is, again, seeing that heart rate variability and heart rate were distinguishing factors between these types of seizures, and potentially that these could be used as a sensitive and specific diagnostic tool. So I know we weren't talking about diagnostic tools, but because I was sharing so much about heart rate variability, I wanted to bring that in as, wow, this is, because this is something we use all of the time in our own assessment and treatment. And that would be really cool if that could be a diagnostic indicator as well for functional seizures. But one of my biggest pieces of advice then for clinicians who are working with folks with functional seizures and maybe feel like, I don't know what I can test here. I don't know where I could influence the outcome. I'm going to recommend autonomic nervous system, sensory system. These are systems that a physical therapist, an occupational therapist, a speech therapist, a psychologist have great windows of opportunity into. Use heart rate variability monitoring. So again, I use the Leaf, but this can be done in many ways, a polar heart rate monitor and so on. Use heart rate variability to monitor it, and then use those treatment techniques in the sensory system, whether that's grounding, whether that's incorporating different sensations, vestibular sensations, proprioceptive sensations, waiting for the person, visual sensations, smell, all of those pieces into treatment, and then autonomic pieces. So breath work, rocking, joyful movements, getting outside, visual scanning and awareness. All of those pieces of the autonomic help with the nervous system regulation. And when we have a wider window to which we can be more regulated in the nervous system, we have a greater opportunity to be able to stay regulated. Even when life throws us the most unexpected curveballs. And for a lot of folks, that can be environmental pieces that we have no control over, and that can feel so scary. But if we have more tools, sensory and autonomic regulation tools, those things can be less scary because we have more control. And what we've learned from the literature is helping a person regain control helps eliminate seizures, truly eliminate them, which is so powerful. So again, to summarize, today we talked about treatment in functional seizures. We talked about the literature, which has primarily been in the psychological world, but there are pieces that we can pull into physical therapy and occupational therapy, bottom-up regulation, meaning body to brain, which is sensory and autonomic. We talked about the retraining and control therapy, which is highly effective in pediatric seizures, and how we can actually help folks improve control through any type of therapy as well, and help them regain their lives with functional seizures. So much that we can do. I want to end with I shared those 4 steps, and I'm going to pull them up here. I posted this yesterday, but I think let me pull them up here, for our clinicians who are working with people with functional seizures. I think it's really important to have a plan and to create this plan with your patient. It's not your plan. It's really their plan. You're empowering them to use this in the moment with you, but also with their family, at school, at work, wherever they are. And so if you want to see the step-by-step, I put this in the post yesterday. Number 1, recognizing the warning signs of a seizure. This takes a lot of interoceptive practice, sensory practice, autonomic practice, making sure you're safe and making sure this is for the patient. The patient is safe. And then nervous system regulation strategies to regulate the brain and the body. And maybe that actually helps avert a seizure. So maybe the seizure doesn't come on even when you feel the warning signs, or it helps you ride it out. And then finally, having those nervous system regulation strategies to re-regulate after the seizure. Folks have asked about this, well, maybe I lost my memory, or maybe I had more weakness after my functional seizure. And that can occur as part of a functional neurologic disorder. It's usually not permanent. And in fact, I don't know that I've ever seen that is permanent. But it can feel so incredibly scary to have that occur. And those signs are of continued nervous system dysregulation. So that's why it's so important to kind of have that nervous system regulation, to ride it out and to come back after that. Somebody asked, what to do if you don't get warning signs? And this is thank you for asking that. What a great question, because I think this is one of the things that I frequently get asked from our patients and even from our team of like, we haven't quite found warning signs yet. And this is often due to a couple of pieces that might need to be tested out. So one is interoception. So if a person has an impairment in interoception is the sensation of the internal state, internal self. And in some people, genetically, developmentally, they don't have a great sense of their internal state. For example, people who are autistic can often, not everybody can often, but they can often have impairments in interoception, in the ability to read their inner state. And so in that case, that person might not have warning signs. And therefore, we need to actually work on their interoceptive awareness. Now, I'm saying this, that's actually not my forte, that's not my specialty, but it is OT. As OT and psychology really, really good at working on that interoceptive awareness. Other folks actually have a highly, in fact, overly attuned interoceptive awareness. They have incredible sensitivity to their internal states and environmental states. And what we actually need to do is ramp that down. And so that's why this is not a one size fits all. Like, everybody improve your interoceptive awareness. That actually would really backfire for the person who has an overly attuned state. So that is one. If you're not getting warning signs, you would want, and what I would suggest is to work with a great OT who can help assess your interoceptive awareness and help you improve that interoceptive awareness. Second, and I have said this term, I feel like so many times today, but heart rate variability. So this, I feel like, is like a missing piece for some folks, that they may not know where their autonomic nervous system is, and they need a window into that. And that window is assessing heart rate variability. When I was looking into measuring heart rate variability, I did this myself. And I actually had no idea what my autonomic nervous system was doing. And I got a lot of feedback from biofeedback from this device, and I loved it. It actually really changed how I was functioning, to be honest. So that could be a missing piece as well when it comes to warning signs. And what this person says, this means me and my therapist are right on track. I'm currently learning more about the mind and body links. Yes, you know what? Many of us do not really fully understand our brain and body. And that's no fault of us. It's just we didn't learn. It's just like muscle strength. It's just like joints and flexibility. Sometimes we just don't know what we don't know. We don't realize maybe these systems are not coordinating and communicating well with each other, and we just need a little bit of help to figure that out and help those systems connect and talk to each other in an appropriate way. So I'm really happy you asked that question, and I'm glad you have therapists to help you figure that out. I think sometimes it's just hard to figure it out on your own. I didn't figure it out on my own. I got a lot of help. I don't think we should be ashamed of that, of needing help to figure out our brain and body. It's not like it just comes naturally to everybody. So awesome. I'm so glad you have that. Here's a question too. Could you also make a video about stupor? Ooh, that's a good question. There's many ranges of that. So I'm going to ask you to send me a direct message, maybe about that specifically. But we may find stupor. Stupor kind of is on the continuum of like a cognitive state. Stupor, lethargy, obtunded, levels of different consciousness and awareness. Those can come with functional seizures, right? So thanks for the great question. Send me a message, maybe with some more specifics, and we can talk about that as well. Because the brain is... these pieces don't function alone in a vacuum, right? Our conscious states, our emotional states, our movement, our sensory systems, our autonomic, they don't function alone. So we can see these cognitive symptoms due to a sensory processing piece, right? So I think that's why I love the brain. That's why I love neuro. I think it's such a beautiful thing. But it also can make it so hard sometimes to figure this out. That's what makes us human, though. It's pretty miraculous, really. So thank you so much for your amazing questions. And again, join our newsletter. You can sign up if you're a clinician, sign up at reactiveeducation.com. If you are a person with a neurologic disorder or family friend, sign up at reactivept.com. We had a lot of research today and earlier this week. I'll send out all the links to those. I will send out all of our videos, so you have all the videos together as well. And keep the questions coming. I really appreciate them. And we'll see you next week. Thanks so much.